Why strength maintenance matters after 60.
Muscle mass and strength naturally decline with age, but regular resistance training can help slow this process. For athletes over 60, maintaining strength means better performance, improved balance, and greater independence. Effective workouts not only support competitive goals, but also help reduce the risk of injuries and chronic health issues.
Choosing safe and effective exercises.
Compound movements are the foundation for senior athletes' strength routines. Focus on exercises like squats, lunges, push-ups, and rows, which engage multiple muscle groups and mimic everyday activities. Incorporate free weights, resistance bands, or bodyweight exercises. Prioritize correct form and controlled movements to maximize benefits while minimizing injury risks.
Recommended weekly workout routine.
Aim for 2 to 3 strength sessions per week, with at least 1 day of rest between them. Warm up with light cardio and dynamic stretching. Perform 1 to 3 sets of 8 to 12 repetitions for each exercise. Gradually increase resistance as tolerated, but listen to your body and avoid overexertion. Consistency is key to seeing lasting results.
Supporting muscle with recovery and nutrition.
Adequate rest and proper nutrition are crucial for strength maintenance. Allow muscles time to recover after workouts and include high-quality protein sources in your diet to aid repair and growth. Stay hydrated and consider consulting a healthcare provider or dietitian to tailor your nutrition plan to your unique needs.
Staying motivated and safe.
Set realistic performance goals and track your progress to stay motivated. Train with a partner or group for added encouragement. Always listen to your body, modify exercises when needed, and consult with fitness professionals or medical experts before starting new routines, especially if you have health concerns or past injuries.